So I'll start with a definition of design thinking. Design thinking is an emerging field. It uses tools and processes from the design disciplines like architecture, landscape architecture, graphic design for use for systems and processes. And specifically, design thinking is something I suggest for innovation in public health, as with many other disciplines. Business and healthcare are early adopters of design thinking. So I think by correlation, public health is already embedded in kind of the realm of using design thinking in many ways. Design thinking has a step-by-step process. It's simplified by IDEO school into these 5 steps: empathy, define, ideate, prototype, and test. Of these steps, I'm going to focus on a few just to kind of get into deeper. Empathy is really important. It's really about the designers getting deeply understanding what the user's needs are. So it's a very important part of the step. It defines and influences all the steps that follow. Also, ideate is important. It's a little different from the usual ideation and brainstorming. It includes visuals. So drawing is part of it. And even if you think you can't draw, because of course we've schooled out creativity from most of us, and even if we are born creative, it's important to draw. The third is prototyping, and this is about low resolution, quick prototyping, taking ideas from just their kind of things in the brain to something physical. So that's important. And essentially what I think design thinking has to offer is that it's taking now design from application beyond products to systems and processes, which is going to be useful for public health. It's also about engaging large groups of people in creative solutions, not only in terms of sort of engaging them in brainstorming the ideas, but also giving feedback through the process. It also confirms to me that we are now in the age of creative literacy. It's not enough to just be consumers of creativity in some way, but we are active players in this. And it's very important when our systems have been designed by the few for the few and are not working for the many. So design thinking is about bringing it to the many. And I went back to the august Wikipedia definition of public health, and it's about science, the science and art of preventing disease, and it's about organized efforts and choices. And that's why design thinking is important. I'm referring here to the Design for Community Resilience program that I lead at the Center for Sustainable Building Research, where we apply design thinking with communities across Minnesota. And one of the things related to public health is fostering local and urban, rural food production projects that are about community gardens and greenhouses, which are directly connected to public health. In this, we engage communities to actually help shape their environments and influence the design. Another public health-related effort is also physical activity and connection to nature. So for example, we've just started work with Ellen Hopkins Elementary School in Moorhead, where we're developing a nature-based play space for kids. And we keep pushing sort of the design and community engagement part of it. So we've started with asking the kids what they think of nature, what they would like to see, and they're going to give us feedback as we develop the designs, also in partnership with the Parent-Teacher Council and other things. Also, in terms of our food systems, given the very cold climate we live in, what's possible in also not only growing food around the year, but also engaging people. So we worked with Minnesota Adult and Teen Challenge and engaged the community in defining that. Finally, I'm going to suggest 3 next steps. First, creatively engage the intergenerational public in design thinking of their spaces and processes, and also schedules for health. Second, I have to refer to my notes here, sorry. Connect people using design processes to their own health and the health of the land, and establish that symbiotic relationship. Engage university, community, and health providers and funders in a cross-sector partnership. So the future of public health is waiting. Let's get started. Thank you.